Welcome to the latest podcast, and I'm here on our Ward D4, which is our spinal surgery unit. It's a unit that cares for about 900 patients every year with a really dedicated team of 24 specialist staff who've been trained in the care of spinal surgery. The patients range in age from everything from 16 up to, I think our record being somebody who was 101. The majority of the spinal cases are as a result of some kind of trauma, such as either a road traffic accident or some other form of accident. And very recently they've started a new form of service which is around C-spine surgery, which is a very specialist form of care. And it means they can be more local to then being able to go home as soon as possible. So thank you to the staff here, and for those patients I know who we care for, there is nothing but huge praise for the unit. We continue, I'm afraid, to face significant challenges with the accident and emergency 4-hour wait. And whilst the position is slightly easier than it has been over the Christmas and early January period, it is still far from being resolved. And for those patients who have to wait longer than 4 hours, I apologise unreservedly. However, we're continuing to do the work not only in the hospital to try and improve things, but perhaps more importantly, out of hospital. And we've got a number of further advances in community and social care support that are allowing people to, wherever possible, stay in their own homes without need for coming into the accident and emergency department. And for those people who do need to be admitted, we get them home safely and timely as we possibly can. Those services are around something called crisis response service. They work both out in the community to ensure that if somebody becomes ill at home, we can do a very quick assessment to see if at all possible they can receive the support to stay in their own home. If they then do come into hospital, crisis response can, in accident and emergency, see if there's a possibility that they could be taken home without admission wherever possible. We also have something called recovery at home, which is to support those people who are then discharged home, and a service that we're really starting off on a number of our wards, something called transfer to assess. Up to present, what has happened is that when people have stayed in hospital and they need some form of health or social care support before they can return home, either to their own homes or to a residential or nursing home, we've done that assessment in an acute hospital bed. What we're saying is that actually that kind of assessment is often better done either in a residential, nursing or at all possible in people's own homes. So that assessment of their needs ongoing can be done at home. These are services which are only just being started. Some of them have been live for a matter of only a few weeks. We will of course ensure that we test their efficacy at all times to ensure that whatever we do around keeping people out of hospital is safe, but also to ensure wherever possible we can move people back home as timely as we possibly can. We are looking for a major campaign of nurse recruitment over the coming weeks. And we're looking for specialist nurses, generalist nurses, both qualified registered nurses and qualified unregistered nurses, particularly those who live locally, to come and work in their own hospital or community services. So we'd love to hear from you. Please do make sure that people are shown how they can apply, and we look forward to maybe having you as members of staff in the future. We talk about innovation, and one of the latest innovations is being undertaken by the podiatry department at Kingsgate in the community. And this is really about specialist shoes, that people who can't fit the shoes that you find on the high street, it's to find them comfortable shoes. and it's our own podiatry department in partnership with a commercial organisation. We have been given the very top rating by external accreditation, an A rating for our stroke services here at Stockport. And that means that all three of the specialist stroke hyperacute stroke units in Greater Manchester at Salford, Bury and Stockport have that top rating of an A, which is fantastic for the people who access services in those Greater Manchester hospitals. So we continue to see people surviving stroke in a way never before, often very much better than could have ever been anticipated. And what we're trying to also do is improve still further rehabilitation at home, something we're working with our commissioners on at present. And when that new service is set up, I'll be able to tell you all about it. Well, stroke service are heroes in terms of what they're doing with stroke patients. But we do like our heroes in Stockport. And we've got two of them in our security services. Ali Jarrow and Andy Tobin were two security guards who managed to stop somebody from hurting themselves when they had left the accident and emergency department, and they followed this lady because she looked distressed and managed to stop her from trying to harm herself. This has now been recognised by the National Unsung Heroes Award. So fantastic news. As an organisation, we had already said thank you to them. This is now being done at a public and national level. So well done to both of them.